you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join doctors Joanne and Aaron as they rewrite the rules for women in medicine. Let's begin.
I have a special guest for you in this episode. We're here with Dr. Amna Shabbir. She is a dual board certified physician with advanced training in integrative well-being, performance, behavior change, and leadership development. As a high achiever herself, she understands the pressures of perfectionism and helps individuals and organizations cultivate sustainable well-being without sacrificing performance. Through in person and virtual work, she partners with mission driven leaders to elevate impact while protecting what matters most: well being. Welcome, Amna.
Thank you so much for having me and for that very generous introduction.
We're glad to have you today.
Thank you. I had the pleasure of meeting Amna in person at the Brave Enough conference with Sasha Shilkut, who's also been a guest in our show. And it was like love at first sight. I'm like, and we already had plans for the interview for the podcast. I was like, I cannot wait to have you meet our audience and all the good things that you can share. And in knowing a little bit of what you're doing and watching your TED Talk and all the things, I wanted us to expand on this topic of perfectionism. And before you were in that awesome stage at the TEDx, there was a moment where this stopped serving you. So this is my question. What was happening in your life when you realized perfectionism no longer was serving you, but actually hurting you?
Thank you for that question, Dr. Sotelo. So I think that when I get asked that question, I always get reflective. It's almost like I'm digging again. But I think that I have narrowed down two moments that were the most. And of course, like hindsight is always 20/20 at this point. So I think the biggest moment was when my daughter came home from elementary school and handed me her math test and went like, "Don't even look at that, mommy. I know I was stupid." And the test score was 99 over 100. And I was just absolutely shocked because I am a very supportive mother. I am trying not to do the things that were done to me, as most parents are trying to be the best versions of themselves. And there's nothing more upsetting than your child coming home. And my daughter, my older daughter is very self-driven, wonderful child. And she comes home and she says that. It was that moment that triggered me into deeper reflection. Why is my child thinking this way? What have I done? All moms say this, like, what did I do to her? And that is where I sat down and I started unpacking what perfectionism was. And of course, in that moment, the word didn't come, oh, it's your perfectionism, Amna. It was just this feeling of not being enough, of this internal reflection, and also an instant flashback I had to a moment when I was a young child. And I remember maybe I was 8 years old, and the first time I had called myself stupid. And then that's where the internal negative self-talk had started. So where I am fast forward, looking back at my life, I feel all highs and lows, and predominantly lows that I've had in my life. They were all tied together with this string of perfectionism, from this pressure to perform, to be looking a certain way, to not have that space of internal growth, and just everyone needs to just look flawless all the time. Whether you're internally struggling, you're healing, whatever is happening, you can't show the mess. So looking back, I struggled with very bad postpartum depression, both the time debilitating, the second time I didn't share it with anyone. Looking back, I had health issues, very literal physical health issues for the skeptics out there who struggle with mental health, being considered as important as physical health. I had physical health issues, which I was hiding under the guise of perfectionism. And then, of course, I completely forgot that I'm a South Asian woman, and there was a social cultural layer to that very much, which I was avoiding. So everything had to look completely flawless all the time. And in the moment where my daughter expressed that statement, I realized, wow, something like had to change. And that's what started that entire discovery movement for me.
That is so powerful. And what I love most about that is that, all three of us are physician moms, and that you took the guilt over what kind of mom am I to have produced this thought in my child. And you took it into this beautiful, powerful journey that has now gotten you to a different place and helping share that message with, thousands, maybe it's going to be hundreds of thousands of women across the world, and really taking something that I try to uncouple that guilt, but in this manner, it served you so well.
I so appreciate you saying that because it's so easy to stay in the space of rumination. And of course, I have been there, and most of us are. It's not like you cross some arbitrary line and all of a sudden you are healed. All of a sudden, all your problems disappear. I still struggle with those perfectionistic thoughts and strivings, and I struggle to come up with a good label. And I'm working on my book right now, also surrounding the theme of perfectionism, which has been an entirely interesting journey of itself when you're writing a book about perfectionism while trying not to be a perfectionist and learning the journey on the way. But I think it's so important for us to be able to create that pause between what is happening around us, what's happening, everything often seems like it's happening to us. So when you pause, it allows for those moments of clarity and internal autonomy to come in about what is the action that we can actually take. And I think that it is so hard to feel that autonomy in moments of motherhood, especially. Like, I just feel that instant guilt comes in, instant shame comes in, instant feelings of, oh, I think it's because she was born when I was a resident. Maybe it's that. I don't know. What was it that I did that is now bringing this on? But of course, like, then stepping away and reframing that and learning from that was really important.
I had like flashbacks of my oldest, who is 22. He just turned 22 this week. He's graduating college. And I remember and he was at a Montessori school when he was young. So they didn't have like actual grades, but then he went to regular public school. So it was a shock for him. And I remember him, it was something like that. Like, he had like a good grade and he was a lot of like putting himself down. He would literally put himself in timeout and said, like, I think I should not be allowed to play for 6 hours. And it was like, oh my goodness, I felt so sad. And I wanted to say, like, it's not that big of a deal. Of course, you, right, like for discipline things, you do want to discipline them, but it was so intense. And I remember having those feelings of, how am I showing up, that this is, or both of us, right? Like his dad as well, of how are we showing up in a both parents being physicians and having all this programming and the perfectionism and the high expectations, and what are they learning, and having to have, like you're saying, that mirroring, and then in the reflection of like, okay, I need to be very mindful of the language I use, and right, like what are the examples, how are we showing up. And thank you for sharing that. My goodness, it broke my heart to hear. And yes,
I would love to dive into what you think the real function of perfectionism is, and knowing maybe just like the guilt we shared had some benefit to it. Maybe there's some benefits to perfectionism at times, but also when can it backfire?
I'm going to make some controversial statements, and I'm just going to say right off the bat that they might not land very well for many of the listeners. So whoever gets uncomfortable, please know that I see you, and just inhale and exhale. I don't think perfectionism is a good thing at any level. And I know that this sounds very radical when you say it like that. The things that serve us well, the aspects of what we think are perfectionism that serve us well, I would propose an alternate term that has been around. It's not that something I've created. It's excellenceism. The drive. So whenever I say, oh, perfectionism is not good, everyone, including myself, my former self, felt that I am telling you to lower your standards. That's a very dangerous statement coming from somebody in the practice of medicine, somebody who's supposed to, we're on this conversation's happening on a very different level. So I want to preface this by saying I'm not making dangerous statements, but I'm really inviting you to step away and examine your relationship with perfectionism, a celebrated flaw, a celebrated problem, it's just something we all love. You know, we just love perfectionism. We're so deeply obsessed with it. And I'm inviting you to step away, because the things that you like are not perfectionism. The things that you like are excellence. They fall in the realm of excellenceism. The high standards are not the problem. The problem is what happens when you don't meet those standards. As an excellencist, you're going to continue to learn from that data. Oh, okay, a mistake was made, something didn't go. I set that standard, but I didn't hit it. What can I learn from it? How can I grow from it? What can I change from this space? But as a perfectionist, you're instantly going to trigger your fear responses. You're going to want to hide it. Who wants somebody who makes a mistake and then quickly thinks about covering it up? Or who lives in the fear of making a mistake and then you're going to be found? Hello, imposter syndrome. Hello, all the other problems that we have. So the tight impression management that I am struggling, I am suffering, but I need to have all the answers from the get-go. And because there's no room for learning, there's no room for growth, and everything needs to appear a certain way, is what is perfectionism, is fear. There's no grace, there's no space. But every time you think about excellence, it's actually way more expansive. You have all the ambition that you want in your life. Go do that thing. Be the best version of you. I am not telling you to wear sweatpants and hang out on your couch. You go do the thing. But as an excellencist, you will always be kind. You will always be your own ally when you fail. Well, perfectionism, there's no space for failing because everything has to be perfect. One of the guests on my podcast, Tanya, made this statement. She's like, well, perfection happens in static moments. And I love that statement because that's true. Everything else in life is always evolving. So this is why I like to talk about perfectionism being broken down into the three domains that researchers talk about, rather than the constrictive. Well, there's adaptive and there's maladaptive. I invite the listeners to step away and think of perfectionism in the three domains of, number one, self-oriented perfectionism, which is I must be perfect, which is really where mostly the society these days focuses. The society just wants you to think you are the problem and absolve itself of all the responsibilities of the way you think, why you think the way you think. The second type of perfectionism is other-oriented perfectionism. I expect those around me to be perfect. My residents, my peers, my attendings, my children, my spouses, whoever, name it, that's happening. And the third is socially prescribed perfectionism, in which you think that this entire world, even the random strangers you meet online, expect you to be perfect. And so when you step away and you look at perfectionism in these three terms, it adds so much more context, not just content, because all three of us can go and we can do as much yoga and meditation as we want. But when we go back to the real world where we are all expected to have perfect outcomes, whether it's as women physicians, whether it is in all the other roles that we have, the perfect mother, the one who's got like the perfect hosting ready house all the time, that internal yoga and that internal mindset work is going to fall flat. And that is what the resistance that we're facing is. We have to understand and acknowledge the role of the social cultural landscape in perfectionism. And looking at all the research that's available to us, all three types of perfectionism are rising, especially socially prescribed perfectionism. We know socially prescribed perfectionism and other types are linked to mental health distress. And yet we love perfectionism. And so this is where I invite everyone to really truly examine, what is it that where I want to lean in on this spectrum? Do I want to set high standards and be the best version of me? Or do I want to live in a deficit mindset where I'm constantly afraid of looking and appearing a certain way to the outside world?
That was a master class right there. Thank you so much for all that information. And my head was spinning in so many ways. And because as a psychiatrist, for so many years, I see this in certain personality disorders. This is one of the symptoms. And a lot of patients come in like you said, kind of proud of it. And my question is always, to the expense of what? Like, what is the cost? If a task, because of course it keeps you from delegating, asking for help, and said if a task that should have taken you 30 minutes took 5 hours and it just looks a little prettier, and I'm exaggerating on purpose, like, was that worth it? And I just don't say that's wrong. I just ask them, because sometimes for them the answer is like, yes, because, right, and they have a story about perfectionism in comparison. There's usually, right, like frequently the other side of that coin. And then it's, what's the mental and emotional drain that's coming from that perfectionism, which is a lot of the message that I heard you talking about. And I remember you've probably heard this as well, but many years ago heard Tony Robbins say, perfectionism is the lowest standard that you can have for yourself, because it's impossible. Like, it's not something that no, like, any of us should be aiming for, but yet it's part of, I think, a lot of, we talk a lot in this podcast about the doctor programming and what we learned, and it's, and how often we hear that, like, you have to be perfect, because if not, horrible things happen, or, or our role models, those are some of the traits that they ask us to look up to. And I'm so glad that we're having this conversation and trying to kind of reframe all these concepts to get back, not just as a concept, but think about what's really important of our health and our well-being and our sense of fulfillment and how we're defining success. So again, so powerful.
I wanted to just highlight that word excellenceism. I don't know if I said it right. I think that's the first time I've heard that. I know, Joanne, I think your term you use, is it precision?
Precision, yeah.
As opposed to perfectionism. And as we expand our language around this high quality, as physicians, we must have high quality. And yet I loved also how you clarified, Amna, that one word puts us into fear and anxiety and negative headspace, where that's not going to help us perform better. And just by shifting the word and shifting the endpoint, excellence, we can then keep our brain functioning in a higher state to get closer to that outcome. So thank you so much for giving us some expanded terminology and that context of self, other, and societal perfectionism to help us better recognize where we might be falling into that.
I am so glad. And I also wanted to take a quick note that, yeah, when I'm talking about perfectionism and I'm sitting with a psychiatrist, I do feel a lot of imposterism come up. So thank you, Dr. Sotelo, for being so kind to me. And
no, and I'm here laughing, not in a funny way, but in a thank you, because, right, like, I see you. And again, and that's a whole other episode, right? Like, let's talk about imposter syndrome, right? Because these are all related topics. But like, it triggers another question that I have, because I do love talking about what's going on in our brain. And I joke because I love all this personal development work. I've been in it for decades. And I love also talking about the universe and the woo-woo things. And I love saying, like, how do we take these concepts for our skeptics and explain it also in kind of like what's going on in our brain and central nervous system. And would love to hear a little bit more from you and all the research that you've done in this topic of what's happening in the nervous system when perfectionism shows up, especially for some of us, right, like high-performing professionals.
Absolutely. That's a great question. And there are physiologic manifestations that are happening because of perfectionism. They're all stress-based, that they include our cortisol rhythms going up and down and not in a good direction, insomnia, burnout. We have people suffering from eating disorders, anxiety, depression, all of these. It's a whole host of everything that's happening primarily from this space of stress, whether it is acute sympathetic overdrive, whether it is this prolonged cortisol burn that's happening from holding on so tightly to our impression. And I want to quickly put a pin there and talk about something that's been on my mind, to something earlier that you had mentioned, Dr. Hurley, about medicine and perfectionism in specific. Like, there is no better place than to talk about this topic than in medicine, because it's so critical. Now, after sitting with this subject for so long, I will say this. I think that when we talk about perfectionism in medicine, we're actually dehumanizing our clinicians by expecting them to be perfect all the time. And when they are not perfect all the time, because remember, they're human beings and they're going to make mistakes because they're human beings. Fallibility is part of the equation. We penalize them so much. We don't talk about what goes on when errors happen in a healthy way, and that the gaslighting that happens constantly is immense. So when we expect perfection 100% of the times from human beings as an absolute, we dehumanize them. When we dehumanize our clinicians, we dehumanize our patients. And when we dehumanize our patients, we dehumanize communities. So it's very critical for us to step back and ask ourselves, why do we expect flawlessness from mortal beings that are prone to make errors? And so we have to have this scope of, yes, the high standards, the diligence, the moral responsibility, but nowhere in the middle. It has to be 100% perfection.
And I want to, we're talking general about in medicine. And I want to just point out too, women in medicine, women physicians, we tend to carry heavier emotional burdens with us. When we leave the office, men are more likely to leave it at the office and come home and switch into I'm off mode. And women not only tend to carry that emotional weight with them home and for a while, and they're also carrying more emotional weight for their families, and maybe if they're in the sandwich generation, not only their kids, but the parents or the in-laws. And so really recognizing too, as a woman physician, how heavy that load is. And as you're sharing, how can we then get ourselves working in a healthier neurologic capacity by shifting out of that perfectionism? And I love how many very clear examples you're giving on how unhealthy perfectionism can be.
I really want people to create awareness, because James Baldwin's quote is my all-time favorite. I always bring it up in all my talks, which is, not everything that is faced can be changed, but nothing can be changed until it is faced. And that is the same thing when it comes to perfectionism. Awareness is the first step. If you celebrate something and it's causing you so much misery and pain on the inside, we can't create a fix that comes from it. So definitely awareness is the first step. And I'm happy to share other steps I find that the audience who's listening can find very helpful.
And kind of along this same path, for people whose identity is built around being the reliable one, the high achiever, what does letting go of perfectionism feel like it threatens? And what does it actually create on the other side?
I think the first thing that pops up when somebody talks about a high performer, a high achiever, now we're talking about this high pressure state, whether you're holding that state as the perfect daughter or the perfect doctor, doctor, mom, all of those different roles that you have, and you're holding on so rigidly, when you're so worried about creating this extreme black and white scenario. So extreme binary thinking that either it has to be perfect or it's zero. Everything is done. And that cognitive distortion is so massively present. And I think that is the biggest one that comes in. There's no space for creativity or growth when you're really staying in that space that you can't delegate, you can't ask for help. So I would say that really predominates.
This is great language also to share, right? Because we all work with women in medicine, and I remember a while back, a coach that I had worked with, he said, you want to be more successful, lower your expectations. And I was like, what? Like what you were saying earlier, like, that's like rough. Like we don't we don't want to hear that, and that's not how our brain is wired. And when we understand this as, and I like how you said it, in terms of deficit mindset versus the high standards, and then thinking this is as bad for your brain as being in an extremely stressful situation, and it's the same pathways of, we understand fight or flight, and then thinking about it, that's what you're doing to your brain. Is that what you really want? Is that where you want to spend your mental and emotional energy? And then a better question is there a better way where you still keep your high standards, still in creativity, still moving forward, it right, like with endless possibilities, rather than, like you said, binary all or nothing, which just keeps us stuck, and it's not good for our brain. It's that I like that as a way to, right, like I can see other women physicians really understanding it that way and be like, okay, now I can see where the change can be improvement overall.
And I want to throw in another aspect of this that maybe you can comment on, Dr. Shabbir, is that piece of trauma. So I worked in child abuse medicine for 10 years, have a deep trauma lens. Joanne being in psychiatry, same thing. I can only imagine that perfectionism added with a history of trauma, whether it's secondary trauma from being a physician, whether it's, primary trauma from what's happened in your life. What are your thoughts on that aspect of trauma plus perfectionism?
The short answer is absolutely. And the problem is that when we talk again in strictly individual terms and make it one person's problem, we again start removing all these layers, right? The more we talk about it, the more we realize this is complex and we should talk about this. So in my conversations with different high achievers, including researchers who have done lab research on perfectionism and everybody else, what came up was trauma, and when it showed up in the same realm as perfectionism, this was survival. To be perfect and to look perfect was survival. I have to show up a certain way. And it was internalized at some point because it was traumatic, whatever the event was, whether it was big T trauma or small T trauma. So there's an absolute conversation that needs to happen. And I will say we don't talk about it enough. So I appreciate you actually bringing it up.
Yes, and again, I do see it in my office, and I, it's a different way that it shows up that gives you, like, right? And again, to ask the questions about trauma and when did it start, and it's sad because it usually starts early in life, and then it becomes a pattern. Good conversation, definitely important. I wanted to ask you, kind of on shifting gears here, what's on the other side of, if we take all this information and always start with the awareness, and we said, okay, I'm gonna soften this perfectionism. What's on the other side? Like, what's kind of freedom can we experience? And thinking about it in the whole spectrum of emotionally, professionally, how we relate to ourselves and others, what would you say?
I want you to envision this wide open space, whatever works for you. Is it a field filled with flowers? It's expansive. Is it the ocean? That's what's on the other side. It's opportunity and creativity and a breath of fresh air, where there's no restless striving in which you are constantly beating your own self up. Instead, you're building yourself up and you're creating so much joy. And I mean, if the word productivity gives you joy, that's fine. You will be productive. So no matter what domain of your life you look at, it will be expansive. That's been my experience of interviewing others that have been able to release perfectionism, and also working with my own clients and myself. So in the TEDx talk, I talk about the courage bridge, and I'll just mention it briefly here because the reason I chose the name, the courage bridge, as a way for this framework to help others is because that's what it takes. It takes a tremendous amount of courage to allow yourself this moment of reflection that I don't have to be perfect, and there is another alternate, and that is not lowering your standards. So we'll start with that. So the first step on the courage bridge is having the courage to examine your intentions. So much of what we do, whether it is that next degree that we want, whether it's that next board certification, that next unpaid role that you really want to sign up for so that you can beef up your CV, whatever that looks like. Or maybe we talked about preschool and school right now. I was obsessing and so worried which preschool I need to send my child to so that she can then end up in the right college. This is what my brain was doing. And so I had to step back and I had to ask myself what my intention was. To the client that you had mentioned earlier, Dr. Sotelo, that the one who took 5 hours to do a certain task, if her intention was to gain joy and meaning and love from that task, it's okay. Take the 5 hours. If the 5 hours was spent trying to hide flaws and finding fear, then let's talk about that. So, what is your intention behind the action that you're about to take, that next degree, that next accolade? Is it for your growth that you can help other humans around you? Or is that to make your name look like an alphabet soup, which kind of mine does right now? So, I had to stop myself. Or that the school that you're going to send your child to, is it so that your child can be a happy, healthy, productive member of this community, the society? Or is it that you can sit on dinner table conversations and say, oh, my child goes to that school? So examine your intention. That's step one. The second step I invite everyone to do is have the courage to fail with self-compassion. Because perfectionists, we know, are so low in self-compassion and so high in self-criticism, they become failure averse. And how can you grow and get to that expansive state of creativity, whether it's, actually drawing something, for example, or even being an entrepreneur? How can you get to that state if you're so failure averse? Now, imagine if you fail and instead of kicking yourself, you give yourself a hand to help you stand right back up. How amazing would that be? So I invite everybody to be a little bit kinder, and self-compassion itself is such a beautiful topic, and learn more about that. So, and the third step on the courage bridge is having the courage to model your humanity. This conversation that you're hearing today is a part of it. We're openly talking about things that we have thought about. So this, when we talk about socially prescribed perfectionism and the context in which we all are operating these days, everyone is thinking that the other person around them has it all together. And so what if we just share it ourselves humanly and openly? And now when I say this, a lot of us get very uncomfortable. Am I telling you to overshare? Am I telling you to have every conversation needs to turn into a therapy appointment? No. I'll give you an example what I mean by this. There was a moment, and I'm a first year attending, I'm standing in my outpatient primary care clinic, and I get that dreaded call from the daycare that my daughter has a fever. I thought she was fine, and I'd given her Motrin, and I sent her off, and I get the call, and my childcare is nowhere else. Like, I don't have any other childcare that day. I'm it. And I have an entire day of clinic left. I'm standing there, I'm frustrated, and I'm standing in the hallway, and I am just having all the emotions come in of being a woman physician without support, working in a traditional healthcare system, practicing primary care. And my older colleague is phenomenal. He's just walking the hallway. He just in passing says this one phrase that helps me have the reset that I needed in the moment. He says, I remember how hard it was. I remember how hard it was. And I know that there was a time in his life, and he was single parenting. His wife had passed, and he was a single dad taking care of all his kids while practicing medicine full time in the middle of nowhere. And so when he said that, in that moment, he modeled his humanity. He also validated my experience that it's not just me. And I just connected with him. In that moment, I realized I didn't have to be perfect. I just needed, and all he did was he said it in passing. This was not a sit-down conversation. He didn't overshare. He just showed up as a human being. And I was able to take a deep breath, walk in the door, give my patient the care that they deserved and needed, and leave and call the daycare and do whatever else I needed to do to be a mom in that moment. And so I invite everybody to show up more humanly, because you and I know that when we go online, we connect with the influencers that are showing their mess. They're not the ones with the flawless veneer, that we're seeing. So with these three components of examining your intentions, failing with self-compassion, and modeling your humanity, I hope that you can get to that expansive side of perfectionism, away and releasing it and showing up in your more authentic version.
With that being said, you are challenging so many fixed mindsets here, is my hope for our listener if some of this resonates. I would love to get your perspective on our podcast name is Create Meaning in Medicine, Rewriting the Rules for Women Physicians. I would love to hear how you are specifically rewriting the rules for women physicians.
I have to first say that the name of the podcast is fantastic, and that it's a tough question to answer in terms of picking which side, but I'll go with rewriting the rules in medicine. I think that looking back when I had just started working as an early career physician, I thought that there was a very constricted and narrow way in which medicine should be practiced and the way we show up. And that primarily led to a lot of my burnout. And I was not wrong, because that's what you're told, right? You graduate and then you work in a specific way. So for me, I started working as a primary care physician. I was supposed to work 9 to 5, except it was never 9 to 5, more like 5 a.m. to like 10 p.m. So it just made me realize that to rewrite anything, you have to first take off the blinders and again create that awareness. So step one that I learned was there are other ways to exist in your identity as a woman physician, and it doesn't have to look a specific way, and that is okay. To be okay with that was so hard. Subsequently, whatever changes I did involved a lot of crying in the parking lot for a very long time. So for the women physicians out there that are trying to rewrite the rules right now, where it doesn't make sense and you are crying and you are not clear, know that that's okay. That's all right, because nobody said that to me. It's okay. Like the 6th month of crying in your car is okay. And then the second part of rewriting the rules in medicine for me was really being okay in my roles as a non-physician. So all the things that make me a human being and being able to exist in those roles. Like my role as a mother is just as important, if not more, in my role as a woman physician. The things that give me joy have to be outside of medicine, can be outside of medicine, and that is okay. So it's okay to write. It's okay to speak. It's okay to do all those other things that make you a human being, because as somebody who used to be in plays and used to do public speaking quite extensively, used to write poetry, when I entered medical school, I stopped all my creative pursuits and I realized that there was only one very rigid way to show up when you were a woman physician. So I call this phase of my life the unsilencing, and it's okay. It's okay to do all of those things. And I just want this to be the final takeaway, whether it falls in the rewriting the rules for yourself. As a woman physician, you are so incredible, and you are just like such an amazing human and an asset to your community. Don't ever forget that.
I'm floating here with your words. I cannot wait until this podcast is published just to listen to all of this all over again I have a lot of notes, but I want to keep it in my journal because I want to make sure I keep all your words. It's so beautiful. Thank you. Because you have so much to offer. I've heard you in stage and the TED Talk, all of that. I imagine that our audience would like to connect with you. Where can they find you? And we'll make sure to put all the links in the show notes as well.
Thank you so much for this opportunity and for asking that. I invite everyone to watch my TEDx talk. It's titled Perfectionism Has a Solution. It's Not What You Think. And I go in, there's 10 minutes, 31 seconds of this further. And then if you are further interested in learning more about perfectionism in medicine or perfectionism at large, my podcast name is Success Reimagined with Amna Shabbir, MD. You can find all of this at success-curated.com. Thank you so much.
What an amazing conversation. I also have so many notes, and we talked about some new or maybe less familiar terminology, excellenceism, and I would love to see that replacing perfectionism. You're bringing up this cognitive distortion. You shared your courage bridge with the 3 aspects. And what I loved is we always love to be hope-filled and optimistic. And you shared when you release perfectionism, you can have expansiveness, opportunity, and creativity. And I hope our listener finds that as motivating as I did. Thank you again for your sharing with us on our podcast. And for our listener, if you found this podcast helpful, take a moment, share this episode for someone else who needs to hear this message on perfectionism, and let's continue to spread this awareness so we can do something about it with not only our listeners, but those you're connected with. And with that, stay tuned because our next episode is coming right up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.